When I did get pregnant, finally, I really doubled down on trying to regulate my blood sugar. I didn't have any indication that it was dysregulated, but I just was the thing that I really focused on was increasing my protein intake, particularly first thing in the morning, because I read that it was good for blood sugar regulation. Is there a relation to what you're talking about with that, or is that not the same?
Before we begin, I want to share something special with all of you expecting parents out there. As an internationally board certified lactation consultant, I've seen firsthand how a little planning can go a long way to helping you achieve your baby feeding goals. That's why I'm offering you my free ebook. It's called Birth Practices to Support Breastfeeding, and it's a workbook. So check out the link in the description below. Hi, welcome back to Lowe's Lactation Lab. Last week, you heard the beginning of a telehealth consultation with a patient named Catherine. In this consultation, we discover that her baby has been having a lot of difficulty transferring milk at the body, and Catherine has been relying on exclusive pumping to feed her baby with bottles. She also had the added complication of experiencing low milk supply despite pumping regularly and using correct phalange sizes while pumping. So now you are going to hear the part of the consultation where I dive into offering individualized solutions for her particular difficulties. And that is my job as your IBCLC. What I do is take a lot of time to uncover what is making things difficult for you and for your baby. So listen in to hear the solutions I offered, and then you're going to come back to a later episode as she updates us on what has happened in the intervening months since we recorded the interview. Did you also test free T3 and free T4 as a part of that thyroid test? Because those are the indicators that really help us to understand if it's impacting low milk supply.
For this, she had only ordered the TSH. In all of my other thyroid screens, I've always gotten the full panel, or at least in pregnancy, I got the full panel. But this was not that.
Okay. Did it include ferritin, B12, serum iron?
No.
Okay.
It was just a CBC.
Okay. All right. Okay. So, and it was 1.66. 1.66. Okay.
Mm-hmm.
Now, tell me what your other labs were again.
For the CBC? I mean, I don't know. What do you?
Okay. It was the thyroid. You did the thyroid blood test and then anything else?
Just like a general CBC.
Okay. And anything come up in the CBC?
No. The red blood cell count was moderately low. Hemoglobin was low, but the hematocrit was normal. On the low side of normal, but.
And how much did you hemorrhage?
1,200 milliliters. Mostly lost through my tear. So as soon as she could stitch that up was essentially how.
And then tell me, are there other symptoms that you have had that have made you think to get your thyroid checked?
No. Nope.
All right. And I would love to know, so I'm just going to go through some other symptoms that could be related to low milk supply. Do you ever feel like some of these are kind of hard when you're in the postpartum period, because it's yes, I feel all of these, and isn't that normal? So I recognize that, but also it does sort of help me to kind of sparse out what would be the next thing you would want to check to see if there is an underlying root cause. Okay. So, would you, first of all, did you pass your 1 hour glucose test during pregnancy?
Yes, very easily.
Okay, very good. Do you feel sleepy, particularly after meals?
No.
Okay. Do you ever feel irritable or angry or shaky if you haven't eaten?
No. Am I answering this like particularly in like this postpartum time?
Just yes. Mm-hmm.
Yeah. No, actually, like it's very weird. I don't really have an appetite at all.
Mm-hmm.
Like I honestly don't eat a ton. I know that's like that's one of my biggest problems is I like keep telling myself like I'm gonna be better today about hydration and eating. It's just like hard when I'm taking care of her alone because I'll like look up and it'll be 1 o'clock and I'll be like, well, I've eaten like barely anything.
Mm.
Um,
Have you
so
lost weight like more than you would expect?
I don't think so. I mean, I don't know. I don't know. I had gained about 40 pounds in pregnancy and I pretty quickly lost like 20 of those pounds, which I just assume was water weight, but now my weight has stayed
Okay.
consistently.
Okay. At like
Like,
that 20-pound.
yeah, so
Okay.
I'm not like, yeah,
Okay. Okay. But you do have a decreased appetite, you would
yeah,
say. Okay. And
yeah.
do you think it's a decreased appetite or just like eating is just too hard?
No, it's a decreased appetite because
Okay.
I don't like normally I would be like, oh, I'm so hungry, and I never feel hungry. Like I eat meals because
Mm-hmm.
like I should have it's dinner time. I guess I could have dinner, but I almost never feel hungry.
Okay. Any cold intolerance?
No, like some days I had been walking around being like, "Is it cold in here? It feels cold in here." And my husband or my mom or whoever would be around would say no. But that could just be really normal too. Like it would happen like not every day, you know?
Mm-hmm. And then any constipation?
No.
Okay. Any really dry skin or hair?
Yeah, my skin got super dry like immediately, or I would say like in like the two around the maybe the 2 week mark.
Mm-hmm.
Postpartum, like my face was really dry. It was just very weird. Like I couldn't tell if I was having an allergic reaction to something. It was just like so sandpapery.
Mm-hmm.
And so my skin is dry, but it's also like it's winter and when now we have the heat on high for her. And then the only other thing is like my hands, I have like eczema on my hand, which I've never had in my life, but
Mm.
I think it's from like washing bottles so frequently.
Mm.
Mm, so yeah.
Okay. Any hair loss?
No.
Okay. Any muscle aches or stiffness?
No.
Joint pain?
Nope.
Okay. Slowed heart rate?
Not to my knowledge.
Okay. And forgetfulness or difficulty concentrating?
Not anything that I think is outside the realm of like normal for this current time.
Okay. Yeah, I know. I told you it's like a little hard to sparse it out. But and fatigue or weakness, do you feel like that's
No.
okay? And okay, so one of the things I would be interested in hearing about or asking your doctor about, and I can send this to you. I have a form that I create, but in order to understand thyroid function as it relates to milk supply, we really do need to understand, we need to get a full panel. So TSH, TPO, T3, T4, FT3, FT4, reverse T3, as well as cortisol, selenium, magnesium, ferritin, and iron. And because all of these can impact low milk supply. If a person is removing milk regularly and their milk supply does not increase, there has to be a reason why. And it seems like you have sufficient glandular tissue. You've had no surgeries, no trauma to the breasts. Your periods have been regular always in your life, or
No, they were pretty irregular for a long time. Like yeah, I would say they were pretty irregular up until I went on birth control. And then I was on birth control for like now like 12 years maybe. And then I was able to and then I got off of birth control and like got myself pretty regular. Yeah, basically until I got pregnant. Oh, I guess I should also say I like maybe have endometriosis. They don't really know. I definitively have it in my, like, it's really weird, it's in my belly button. Like, they took a biopsy of it, and they confirmed that it's there, but there was no reason to, like, try to see if it was anywhere else, just because there was no way to do that without surgery. Um, so yeah.
Okay. That's good to know. Do you have any dark skin patches, like on your neck, groin, or under your breasts in particular?
No.
Okay. And have you ever been diagnosed with PCOS
No.
or wondered if you had it?
No, I never really thought I did. I don't
Okay.
know why.
Okay.
I just
Do you
yeah.
have any skin tags anywhere?
Yeah, a couple.
Okay. Did you have any trouble getting pregnant? I know you mentioned on being on birth control for a while.
I I didn't have trouble, I don't think. I mean, like, so I basically, but it's tricky because I got a biopsy of the weird thing in my belly button in June. Then I got diagnosed with it being endometriosis, which a twofold, like, caused a lot of stress, and then also they, like, snipped off a piece of this hormonal thing, right? So my I don't know what it was, but then my body definitely, like, my periods became a little bit more irregular, um, in those maybe, like, June, July, August months, and so it took me a while to have regular periods again, but I did get pregnant in that January. So I basically was, like, trying for 6 months, but I really at that point had probably only had maybe, like, 4 cycles. Um, but yeah, I mean, to me, that doesn't feel like too hard of a time,
Okay.
but
And any losses?
no.
Okay. Do you feel like you ever have mood swings, or have you been depressed, or have you thought you might have depression or anxiety?
No.
Okay.
I mean, I generally run quite high with anxiety,
Okay.
um, but, like, never in a way that's been diagnosed or, like, in a way that feels like it impacts my quality of life.
Okay. And any acne that seems like it's coming out of nowhere, or have you always struggled with acne?
My skin has never been great, but in pregnancy, it got really bad. It could just be because I couldn't, like, use a lot of the products that I was able to use, but it definitely got pretty bad, in pregnancy.
Okay. Okay. So the thing that if you wanted to pursue seeing, is there something that is impacting milk supply? I do think it would be worth doing a full panel for TSH and then doing some testing to see if it could be PCOS. Now, I am not a diagnostic provider, but I am a low milk supply specialist. And PCOS, you have enough symptoms that I would suggest you bring it up with your provider. Um, and insulin resistance may be likely with PCOS, and it's common to have insulin resistance in the postpartum period, starting then. So there is like a diagnostic hormonal profile, and you can do some blood testing, including A1C, fasting glucose, fasting insulin, and a metabolic panel and a lipid panel. So before I go on, when I say that there could be some other things that you could test for just to rule out any other underlying causes, does that feel more stressful or less stressful?
It doesn't feel stressful. My immediate like, this is a problem that I have as
Mhm.
a person, but my immediate go-to is I'm like, "Ugh, I don't wanna ask my provider
I
and have
know.
them think that I'm, like, a huge pain in the butt,
I
like, they
know.
just TSH, like, I don't wanna be this, like, psycho person that's asking for all these things." That's, like, where my
I
mind
know.
automatically
Yeah.
goes.
I know. I get that. Yeah, yeah, yeah. Now, one thing I could do is, to help alleviate that, if it would be helpful, is to create a write-up that says, "I'm working with such and such patient. This is what she's doing to improve supply. My clinical observation is that supply should have improved significantly, and she's still producing less than half of what she needs for baby. And based on my experience as a low supply specialist and the symptoms, such and such symptoms that she is experiencing, I suggest that you test for these things, please reach out if you have any questions or concerns, or if you would like to talk about this over the phone, because I would be happy to be the one that says, look, here's the research. This is what we know.
I mean, and I will say, like, so my provider is like Seven Sisters, the birth center. So
Oh,
they're
great.
very they're not weird at all about it. Like, this
Great.
is a
Okay.
like they're totally
Okay.
like like Jenny would be like, yeah, for sure.
Yeah.
But like I am just like this weird person that's like I don't want to like cause problems,
Do you know what? You're not weird, because we've been socialized to make things easy for everybody else, right?
Yeah.
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 It's not weird at all. I hear a lot of people who say, my provider's so supportive, and like, I really hate
Yeah.
asking for this other thing. And especially when it's an amazing provider like Seven Sisters, they'll like flip over backwards for you. And so you never know, like, how are you asking too much based on the services they've provided. But I can also, I'll write it up. I'll write my recommendations up for you anyway. I was already going to do that. And so I can send them to you, and you can either pass them along if you decide you want to do them, or you can ask me to send something, and I would be happy to do that as well.
Okay. Thank you.
Because you have enough symptoms that, like, and some of them overlap, and some of them are just like a normal part of being a mom with a young baby. However, there's enough things being ticked that I'm like, if we could get to an underlying root cause that could be contributing to the slow milk supply, your situation could be improved significantly.
Yeah.
Now, the other thing that we could do is there is a supplement. Are you opposed to supplements at all?
No, I take well, I mean, like, I take a lot of like I take like magnesium as a supplement and omegas as a supplement and choline and all like so no, I'm
Okay.
not.
Okay. There is a supplement that is sold by the Lactation Hub. They are IBCLCs. They are the people who do like the low milk supply specialty course for other IBCLCs. They work very closely with breastfeeding medicine doctors. And they have a supplement called Milkworks IR Plus. It has moringa in it, and myoinositol and D-chiroinositol. It's myoinositol and D-chiroinositol and beta-glucans blend. And we have found that if somebody has an underlying cause of insulin resistance, even if it's just kind of like minor, like maybe the A1C is a little bit elevated, but it's not like crazy elevated, that just this blend of herbs and supplements helps with that insulin resistance, which can then help improve milk supply.
Well, can I ask in terms of the like insulin resistance because I don't know a ton about it, but what is the relation to so like when I did get pregnant finally, I like really doubled down on trying to like regulate my blood sugar. I didn't have any like indication that it was dysregulated, but I just was like the thing that I really focused on was increasing my protein intake, particularly first thing in the morning because I read that was like good for blood sugar regulation. Is there a relation to what you're talking about with that or is that not the same?
Yes, but sometimes your diet can be perfect. You can be doing everything right, and insulin resistance still creeps up. And
It's not perfect right now. Like certainly like I mean I like barely eat healthy foods at this
I
point.
know.
So.
I mean, you have a new baby, right? You're just trying to get any calories in your mouth. But insulin resistance can disrupt the balance of hormones of both prolactin and oxytocin, which are both critical for milk production. So, and it can also affect the functioning of mammary gland cells. And those are responsible for both producing and secreting milk. So they just become less responsive to the signals necessary for milk synthesis when there is any amount of insulin resistance. So sometimes getting that under control so that your body's not having, because what happens is when you have any amount of insulin resistance, your body just starts making more and more and more insulin. And making more and more and more insulin then messes with the signal for the production of milk. And so this is a supplement that's safe to take regardless, but it could help with that it's a supplement to increase milk supply, but that's the mechanism by which it helps increase milk supply. It decreases inflammation. It helps the body to regulate insulin a little bit better so that if there is any of that insulin resistance that's disrupting the hormonal balance, it could help. So if you wanted to try something like that without doing any blood work or anything and seeing if you notice an impact, I'm not saying you're going to go from 8 ounces to 24 overnight, but it could, you may see a noticeable difference.
And there's no like, I see all these people with supplements where they'll say, oh, take this herbal supplement and like I don't know how you say it, like fenugreek or whatever, where
right.
It would help or it could hurt.
Right.
In this case, it's
not going to hurt. Right. Okay. Yeah. There's nothing in it that would decrease milk supply.
Okay.
Yeah. Okay. That's a good question. Yeah. Fenugreek, if you have thyroid disorders, will actually have the opposite effect. So yeah, moringa is the primary herb, and moringa has no negative impact on milk supply and has been shown to have a positive impact. In addition to these other insulin balancing supplements. So,
and if my insulin is like normal or whatever it is, if that is normal, this also won't hurt that, right?
Exactly. Right. Okay. Right. Yeah. 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 So I'll send you a link to that, and you can decide, is it something you want to try or not?
I try it. Like I try every supplement like under the sun.
Right. Weird. Yeah. 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 So that's the milk supply stuff. Now, are you okay? I know we're a little over time. Are you okay to go for just a bit longer?
Okay. At some point, but yeah.
Okay. Yeah. So I just want to talk a little bit about the oral motor dysfunction part. And then if you decide you want to do a follow-up, we can take care of that offline. So this is a document I provide when I do in-person oral motor assessments. And when I talk about, now there are other things that can impact oral motor function before I talk about tethered oral ties. Things like a really high palate, or a bubble palate, or low tone in a baby. But usually you'll kind of notice those things first.
This is the thing that you would ask me what made me think of like certain things with the tie. I follow all these people on Instagram that like talk about things like this even before having a baby. So this was like something I was like hyper aware of when she started doing it. But she like breathes with her mouth open a lot.
Exactly. So that's one of the questions I always ask when I'm doing a tethered oral tie evaluation. Now, IBCLCs, we are not diagnostic providers. So we do not diagnose for tongue ties. But here's what we do. I always tell people when I'm doing an oral motor assessment, I cannot diagnose, but tongue tie and buccal ties and lip ties, it is a symptomatic diagnosis. It is not possible just to look in a baby's mouth and say how much tight tissue could be impacting the baby. Because yes, we get a visual, but if there's any amount of tightness, it could super impact that baby, or it could barely have any impact. And so it is very individual. So what we have to do is, yes, get that visual. And sometimes people will say, you have a slight posterior tie. But it's not slight if you are doing everything right and baby still can't transfer milk. That means that amount of tightness is super impacting that baby.
Right.
And so when I look at what are the symptoms, we track symptoms in the infant, symptoms in the feeding parent, and feeding symptoms. So you can see on this list, like if you have, more than 5 or 6 total symptoms, then I'm thinking, yeah, we got to get you into an evaluation to get it diagnosed by a pediatric dentist.
Yeah, I mean, like with these are the reasons that I had just asked this woman yesterday to look at this because, like, for the feeding symptoms, she's even like she clicks on the bottle, like
Mm-hmm.
even she'll do that. The biting or chomping I told you, she doesn't really slip on and off the breast, but yeah, she the falling asleep while nursing, 100%.
Like
Yeah,
immediately, right? Like it's one thing if you fed for 10 minutes, you're full and you
right.
fall asleep, but it's that like within a few minutes, I'm asleep.
Yep, and then, yeah, I mean, nurses for when I was feeding her, nurses for a long time, but then, like, immediately kind of wanted to feed again. It was hard because I was like, "Is this cluster feeding or is this what?" You know?
Mm-hmm.
Lots of sucks, fewer swallows.
And then you said you have misshapen nipples after she feeds.
Mhm.
You've mentioned clogged ducts a couple of times here that you have a clogged duct on the left side. Now I know you've mostly been pumping, so
Yeah, I mean, the clogged ducts, I think, is I don't know why I get them, but I wouldn't attribute that to her just because, I mean, I didn't nurse her long enough initially for it to really know. Um, I don't ever use her in place just because it, like, would not give her enough food, but I never use her in place of a pump, um, so I wouldn't attribute that to her, but
now we do know, and it's unclear, there's just not enough research. We do not know whether or not it is a correlation or a causation. But babies who have tethered oral tie, their feeding parent, I usually has super high supply or super low supply, one or the
Mm.
other. And you're on that pretty low supply side,
Yeah,
you know.
yeah.
We know we've had slow weight gain, colic, and unsettled behaviors. You said she has lots of reflux, I
Mhm.
mean. Does she have a blister on her upper lip?
No, not currently, but she had before.
Mm-hmm.
Like, I cannot remember I don't remember if it was I feel like it was when she was breastfeeding, like, in the first couple of weeks,
Mm-hmm.
because I do remember looking at that and being like, "Oh, that's weird," and
Mm-hmm.
then but it's now she doesn't
Okay.
know.
White coating on the back of the tongue?
Like, on the tongue,
Mm-hmm.
right? In the Yeah,
Mm-hmm.
because I actually asked the pediatrician if it was, thrush because I wanted to make sure it wasn't.
Mm-hmm. Do people have you always thought she was super strong? Like she's able to hold that head up, and from the very beginning you were like, "Oh my gosh, she's so strong."
Yeah, I actually, I took her to the chiropractor, for two sessions
Mm-hmm.
because, well, I don't know if it was really because of that, even though I knew that that was a thing where you were like, "That's not a great it's not great if, like, your newborn is immediately able to hold their head up," you know? Um, but she had, like, always I felt, like, favored turning her head to one side. Like, every single picture of her I had where she was laying down, like, she was always turning her head to one side. So I did take her to a chiropractor twice. Um, but and he said she had tension, but, like, again, it was one of those sort of, like, unfortunately, it's just, like, one of those models of care where, like, you just have to keep going back, and it's not, like, funds are not, limitless, so it's tough to just keep making visits.
Where did you go?
I saw, I don't even know his last name, Dr. Dan, like, Amy Madger's, um, husband in Northampton.
I know what you're talking about. I don't know them very well, but I've seen them. Like, yeah,
Yeah.
I've gone on their website before.
Yeah, everybody, like, swears by him. There wasn't a whole lot that was going on, like, in in the appointment. I mean, obviously, as there shouldn't be, like, I was very much so like, "Please don't do anything aggressive," obviously, right? Like, she's just a couple weeks old, but it was just a lot of, like, touching of her head, and then when I kind of would ask for, like, the description of what was happening, or, like, I wanted to know, like, I was like, "Do you feel tension?" I wanted to know, like, where, what, was there something I could be doing to improve it? And he was just like, "Yeah, there's some tension. Um, come back in 2 days. Come back in a week." And I was like, "Okay." I mean, you know,
Yeah. Yeah.
but
Where do you live again? Montague? Wilbraham.
uh, no, we live in Wilbraham, yeah.
Wilbraham. Okay. If you look at this list, it's screaming tethered oral
Yeah.
ties.
Yeah. No, I know.
Yeah.
That's why I was surprised yesterday when, the woman looked and said that she didn't think that, and why um, I've had two people say that
Yeah. And
totally
I don't know the lady at Cooley very well. What's her name? Lisa?
Lisa,
Okay, yeah.
yeah.
I've emailed with her a bit. I know Lex Beach very well. I love her. I think she's amazing.
Well, that's the thing is
Right.
like I forget if I told you this, but I finally was like, what do I do? Because like Lex is at a loss. Like
Mm-hmm.
Lex, great. Like everybody says, like Lex, don't like
Mm-hmm.
this. And it's kind of like my last visit with Lex was sort of just like, yeah, I'm always here, reach out. Cause like, I honestly think she doesn't know what else to
Right,
do.
right,
I
right.
like,
Yeah. And you know what?
um,
That happens to all of us where we're like, oh
yeah,
my gosh. But I am puzzled by her assessment that it's not ties
she
because,
had her in her mouth
yep.
and she said it felt really good, really normal. She's watched her feed now a ton of times.
Mm-hmm.
I think she's even watched her feed from a bottle. I can't remember, but I think she has.
Yeah. She probably recommended those bottles to you, the pigeon and the even
Yeah,
float. Yeah.
and then I think I explicitly asked her to check for
Yeah, I
ties.
know. She's usually really good at identifying ties. However, if she's not looking at it symptomatically like this, if she's just doing an oral and feeling a suck, every baby moves their body just a little bit differently, right? And so, sometimes I'm feeling a baby and I'm like, it feels good, but you have all of these symptoms. And it's the symptoms that really matter because if you're having all of these difficulties and no one can say why, there has to be a reason why, right?
Yeah.
And so if no one else can say this is the reason why she's transferring 0.3 ounces, but chugging 3 to 4 ounces from a bottle, no problem, then there has to be a reason why we can't get the milk out. Now,
Yeah.
low milk supply can impact that. But listen,
I'm like, if I just had more milk, would she not just be able to,
right. But if
you
you're
know,
able to pump 1.5 ounces, why can't she transfer 1.5 ounces? Like it would be a
that's
different thing if we were like, okay, she's able to transfer whatever I'm able to make. I just can't make enough. Well, then that's a totally different conversation. But if at every weighted feed you're seeing like hardly anything transferred, then and she looked good. Her latch looked okay, right? And when I was counting, I was like, okay, it seems like there's a swallow every 3 to 4 sucks, which is, it's a little outside what we consider normal, but we consider 2 to 3 sucks per swallow from the breast normal. But 4 isn't that much beyond that. Like when I'm seeing a baby that really can't transfer well, it's usually like 7, 8 sucks per swallow. So what is it that she's swallowing if it's not milk? Is she swallowing her saliva? Is she generating enough saliva that she's swallowing that? Because she is swallowing, but what is it? And could that extra swallowing of saliva based on, how she's latching be contributing to the acid reflux, for instance? Like, so if it were me, I would go see the pediatric dentist and I would get a diagnosis, yay or nay.
okay. Yeah, I had actually already reached out to, I'm sure like Dr. Shapey,
Mm-hmm.
but and when I had done that, I was unclear on what their policy was because I sort of had heard that they prefer that you have a diagnosis from a lactation consultant to like send you there because they basically they want you there, and then in that moment they basically want to say like, yes it is, let's do it now.
So here's kind of where it's weird, right? Because IBCLCs, we are not diagnostic providers. We cannot diagnose. We can provide assessments. It's a weird scope, right? Because we're clinical providers, but other providers get weird when we start diagnosing. So we provide a clinical assessment. So he provides the official diagnosis, or whichever provider you go to. They are the ones that actually give you the diagnosis. But he wants you working with an IBCLC and a body worker, either a chiropractor or craniosacral therapist before and after, because the outcomes post release are way better if you have done everything you can to improve milk supply and to improve the baby's latch as it is. So if you're going, so it's not that he wants the diagnosis, he wants to see notes from an IBCLC that says, we've done everything. It is very clear that this baby is struggling and there's nothing else we can adapt at the breast or with pumping.
Yeah.
And so Dr. Shamey, he's an amazing provider. I love him. He's expensive. So if insurance does cover, I don't know how much United Healthcare covers. There is another provider that I have really started to work with a lot recently. Her name's Dr. Andrea Fallon. She's in Springfield. She's very good, very great bedside manner. And even if your insurance doesn't cover it, the out-of-pocket cost is so much lower than even the copay at Dr. Shamey's.
Okay.
And she's done really good work on a good handful of my patients in the last year. And she is a mom herself. Her baby had tethered oral ties, which is what had made her switch the type of dentistry she was focusing on.
You know, if she does she laser as well?
She does use a laser. Yeah. Yeah, she's a pediatric dentist as well. She has a really good laser. Typically if you go in, she is willing to do it that same day, but it's also no pressure. She wants you to feel comfortable making the decision that feels right for you. So same with Dr. Shamey. He's amazing. I love him too. But, when you're throwing so much money into trying to get to the bottom of all of your root causes, if you can save some money here and there, I have totally been there and I get it.
Yeah.
The other thing I might suggest is doing either some body work like massage or OT, which is usually will be covered by insurance, or cranial sacral therapy, which is not covered by insurance, but can do amazing work. So you can kind of look at those 3 scopes. I'll send you a recommendation and you can decide which feels the right for us. Have you thought about early intervention at all?
No.
So early intervention, it's a program that's run by the state, and they contract providers out all across the state. It's fully covered by insurance, and I believe it's free even if your insurance doesn't cover it. They try to bill insurance if they can, but if not, they provide no-cost services. And what they do is they send out a team for an evaluation, an SLP, a speech language pathologist, which they deal with infant feeding. OT, occupational therapist, they deal with infant feeding. So it's weird. Their scopes overlap and it depends on what they have specialized in. But sometimes it's like a swallowing issue. So the SLP does that. Sometimes it's an oral motor function issue, which could be both SLP or OT. Sometimes it's a whole body tension issue. So the OT is good for that. So several practitioners will come to the house, they'll do an evaluation. And if they're like, oh yeah, we're seeing reduced oral motor function, we're seeing a lot of bodily tension that is making baby have reflux, be uncomfortable, be colicky, have difficulty feeding, then they'll provide in-home services to you and they'll outline a plan. So you can ask for that, or I can submit a referral for you as a professional, and they'll call you and set up a time to do an evaluation. And that's a way to get some body work and to get an evaluation of all the oral motor function, because there's some oral motor function that's outside of our scope. That would be more the scope of an SLP. So if there was something else going on that wasn't a tethered oral tie, that could help you to understand, why can she not do this thing that mammals have evolved to do, right?
Right. Yeah.
What do you feel when I give that recommendation? How does that make you? How does that sit with you?
I mean, I guess I just am curious what you think is it sounds like there's a couple of things that I could do. And I guess I'm just curious what you think is the best path. Do I try to see the pediatric dentist? I also have this fear that I'm gonna see them and they're gonna be like, yeah, she has a tie, let's let's deal with it. And either she really maybe didn't need to have that surgery or procedure, or maybe like, she has a tie and we do that, but that's not actually like the thing that's inhibiting the feeding. I don't know.
Mm-hmm. Yeah,
But
I get that worry. And
yeah.
I have that worry as a practitioner, right? That I recommend that
Right,
you do this thing to your baby and then you see no noticeable difference. So
right,
I'm
right,
right there with you.
right.
None of us want anything to happen to a baby that is going to cause some pain that, is going to alter their oral tissues or any part of them if it's not necessary. The thing I always bring it back to is then what? If it's not that, then what is it?
Right, right.
And I think the most frustrating thing about having breastfeeding difficulties is the fact that so many people have them and nobody can tell them why. You're like,
Yeah.
we we're mammals. Like our babies should be able to transfer milk from our bodies. So
Right.
why isn't my baby? Now there's a bigger issue of why are so many babies struggling to do this thing that until the 20th century really there was not difficulty. But that's an anthropological issue, not a like clinical it's going to help you in this moment.
Yeah.
So that's kind of a long-winded way of me saying if I were to outline a path for you, which I just want you to know I have skin in your game because I want you to
Yeah, yeah,
get
yeah.
resolution, but whatever you choose to do, I'm going to be your big cheerleader behind you saying, "All right, great. Like if that's what feels right, then do that." But if it were me, I would go ahead and do the evaluation from early intervention
Okay.
just to rule anything out that would not be tethered oral tissues
Mhm.
and go to the pediatric dentist because you've done literally everything else.
Yeah.
And
And would you say I should do that? I mean, because I know, like, we kind of, like, split to now talking about this side of for my daughter, but would you say I should do that simultaneously or before or after I try to increase my milk supply?
simultaneously, yeah, because you definitely do want to increase your supply. Having more milk is going to help your daughter to be able to
Right, right,
transfer milk. And her being able to transfer milk is going to help you to create more milk.
right.
So I do think we need to work on the phalange sizing stuff, get that figure out why the spectra is worse with one side instead of two, do that experimenting, and I'll outline those in my notes that I sent to you. We need to either get to the root cause of the low milk supply by doing a little bit more digging into the blood work, or
Mhm.
just say, you know what, we're going to try that supplement first thing and just see if I notice an impact.
Yeah.
So you kind of have a choice there. So I'll have that outlined. And then let's figure out why she's getting 0.33 ounce transfers at the breast when you're able to pump 1 ounce to 2 ounces.
Right, right.
Does that feel like it's doable to do like together?
Yeah, yeah. I mean, it's close to what I sort of was, like, thinking I should do. I guess I just, like, I don't know. You need somebody to say, like, "Yeah, this sounds like the right thing to do," or you know what I mean?
I know. And you know what? We all, I think Lisa and Lex do great work. I won't keep this in the podcast. I think they do great work. And we all have those moments where we miss the mark. Every person
Right.
does, right? And it sounds like they've helped you get to where you are. And that has been really great and supportive. And I just keep going back to if it's not a tethered oral tie, then what is it?
Yeah. That's truly like when I showed up in her office yesterday, I was so convinced. And even when I got home, my husband was like, I guess it's like good, but it's kind of frustrating because like we wanted to just hear yes that she had it because that is what we had convinced ourselves it was,
Yeah,
you
yeah.
know?
And when I always send if you go whichever pediatric dentist you go to, if you decide to do that, I'll send my notes. But I can also have a conversation with them and say, look, she's been through the ringer. She's seen so many IBCLCs. It's like visually it's on the fence about whether or not it's there because there's pretty good mobility and oral motor function. However, she's doing everything right and cannot increase milk supply and cannot get a transfer at the breast. And she has all of the symptoms that are pointing to tethered oral tie.
Yeah.
So that would be my recommendation.
Okay.
And I'm glad that it feels kind of in line with what you were thinking already.
Yeah, no, it definitely does.
Okay.
It definitely does.
Okay. Awesome. So I will type up, I'll send you extensive notes over the portal. If I said I would send something and I forget, just send me a chat. I've been taking notes as we've talked, but sometimes, I don't get them all.
Yeah.
So I'll send out some decision trees for you, my low milk supply recommendations, my oral motor function recommendations. Would you like me to submit a referral to early intervention, or would you like me to send you the link so you can look at it and decide?
I'll look at the link because I've literally never heard of this before.
Okay.
But yeah.
Okay. So I'm just going to make a note of that. So I'll get you those notes here in the next couple of days.
Okay.
And I'll send you over the client portal, Dr. Andrea Fallon's info, just in case you want to reach out to her before I get my notes cleaned up, and the low milk supply supplement as well. And then that'll get you going initially. And then if you have any questions at all, just chat me on the portal. Okay.
Great. Awesome. Thank you so much. I really appreciate this. This was very helpful.
Oh, good. I'm so glad. And it's going to be a while before this episode comes out, honestly, because I have a backup and I had to stop recording for a while. But I'll let you know when it does. And I'll make sure to send you a link.
Awesome.
Okay.
Yeah.
Great. Thank you so much for being willing to record. I think it will really help other people who are struggling with similar issues because this happens too frequently.
Yeah. I hope. I mean, that's why I was like, yeah, sure, go for it. It's been a lot, so it would be nice to help anybody that also is dealing with it.
Exactly. All right, hang in there. Go give that baby a hug. She sounds like she needs her mom.
She was, yeah. All right, thank you so much.
All right, bye.
Bye.
Okay, Lo again here. So you just finished listening to the part of my telehealth consultation with Catherine where I offer solutions to all the difficulties that she described in her first episode. As you can see, working with an IBCLC should feel collaborative. It should feel like you are both on the same team looking for solutions that are doable for you and for your baby, and that they are new solutions that you haven't tried before. If you remember, Catherine saw 2 other IBCLCs before she came to me for this telehealth consultation. And that is just a good reminder that if you aren't getting to the bottom of your lactation difficulties, it's okay to try to find somebody else who is able to help you more specifically with your problem and get to the solutions that is going to work best for you. Catherine later wrote me and told me that it turns out her daughter does have tethered oral ties, as I had suspected based on the symptoms that she described to me. So you're going to be hearing from her again in the future to uncover what her feeding journey looks like now and what has changed and what has remained the same. Thank you so much for tuning in. See you next week.